it was striking to me at the challenges that were faced at the individual level, at the family level, at the institutional level, and the community level with these students. You know, in a sense, I always thought that the system across all of those spectrums did not prepare these students to come to this school. Like, it's an extreme change in environment. It's an extreme disruption of all of the things that made them whole and effective and bright students and so on. And all of that has just suddenly been disrupted, and suddenly it's freshman orientation. And freshman orientation is wonderful, but in most places, it simply does not address the fact that this is a huge, huge change in these young people's lives. And they bring stuff with them, and they're going to get stuff here, you know, at the university and so on, but poorly prepared to deal with all of that disruption. So no wonder, you know, in schizophrenia, this is where you see the first episode. With you know, all of those changes leading to stress and all that stuff snowballs right into, I think like the first semester, you know, I used to get all the psychotic students, and, you know, just freshmen, boom, you know, 1-2 months into it. So then you have to think about, okay, what do you have to do with all of these systems and all of the changes to help? And it's been done. You talked about a program, like we need the data, right? We need information, like, you know, people have, a lot of universities try different programs and intervention and that sort of stuff. They don't write about it, they don't tell people about it. We don't know if it works or not. We don't know what it helps with, if it helps at all. So we need, in this area, we need to bring some science to understanding how do we best help people. And I'd like to prioritize that. The first thing is you want to do is save lives. Like, it's about saving lives. These kids are at high risk, and the system's not set up to address that high risk, and we can lose them. The first priority is how do we save lives? And again, looking at all of those levels, individual, family, institution, and the community, you know, what needs to be done to identify people at risk, give them the right support, and prevent them from taking their lives. That's, like, I see it, number one priority. Okay, second priority, we want to help people who are in distress. And my goal is, and this is I often battle with the institutions, because my goal is different from the institution's goal. Right, Paul? My goal is to keep them in school, because I know that with the programs that we have set up for the young people, that if we keep them in school, they have the best shot. When the university's goal is we can't manage the risk, we need to get them off campus, send them home, gotta be out of school for a year, and they gotta take a course or two to get back in, and they're gone. Never to be seen again, the majority of those students. And I'm thinking, if the student got accepted to college, aren't you inviting them in as family? Aren't you supposed to say, no, you're not? But, okay, but you should, like, it's an investment. Like, because that student could go on and donate $100 million in 20 years. I want that student to stay in school, get that degree, go to Wall Street or whatever. But it should be inviting them in as family. And as you pointed out, like, family play a big role. And one of the things that you know, it's like you think about what works for people, and then you think about what are the systems that are in place and what are the rules and regulations and stuff. It totally disrupts the natural aspects of coping and help, and who do you turn to and that sort of stuff. And I struggled with, you know, okay, these are adults now, and so someone mentioned The parents they're not told about the smoking of marijuana and all that stuff. I mean, we've had people, like, parents didn't know that they were hospitalized, right? And so because they didn't give permission for the parent to be told that they're hospitalized, the parents weren't told. And one student had 3, 4 hospitalizations and eventually killed herself, right? Parents had no idea, and that is crazy. It's crazy. So, but it's a struggle because you got rules and regulations, you got HIPAA, you got all of these barriers that disconnect the students from a huge support, potentially. Now, sometimes that family is a negative, and that's another issue, but it's the systems and the rules that take away the natural processes for people to reach out, and it can be very disruptive. And that's typical at the university settings. This is an adult now. We treat them like an adult. Johnny is injecting himself with insulin to get, because everybody else is going to get high. That's problematic. Somebody needs to make a call to that parent. But you'll see that we can't do that and so on. But so when you're trying to identify kids at risk and you're trying to tap into what resources are available, we've cut the family out at the university setting for the most part. It's just been cut out. Because of that. So I think that is it's important. Now, what I've found with many of these bright young people of color is that I think somebody's used this word before, that lack of connectedness. The lack of connectedness. Like I just so surprised. Like even when there are programs set up, and it's usually ethnicity-based programs. Well, there's diversity within diversity, and people have had different experiences, and so they may not necessarily fit with whatever what they're if they check the box, they're sent to, okay, the first day you get to go to the African American house, Well, that's great, except for it may not be what you're all about in a sense. You may not actually be comfortable going to that house because you had a different experience. Maybe because of where you grew up, all of your friends were Hispanic or Latino or Asian or white or whatever, and then suddenly you are put here. And that's one thing that I saw over and over again. The university has identified these individuals as such. This is who you are. But they're not comfortable there. That's not who they see themselves, who they are, or they haven't gotten there yet. And therefore, and that activity over here takes them away from activities over here and here that they may actually be more comfortable with. And so this was like a typical scenario. You got a comment? You look like you have a comment. Oh, okay. You're just, oh, okay. So it's the, anyway, so that's another area that, people come in and that isolation, that lack of connectedness, they don't connect with a natural group. They don't fit in. They're struggling with their identity. They're struggling with, like at MIT, it didn't matter what you looked like, you got beat down. The professors say that the professors had a model that, and I've sat in many meetings, and they said, well, because we're all valedictorians, perfect SATs, all 4.0s, or 5.0s. I don't know how they did that, and they had a model that said we beat them down, and then we build them up by junior year. Well, the folks of color didn't make it to junior year. When you start beating them down like that, and not having the support and the support network and so on, they're gone. So they beat them down, they weeded them out, and it's a rough process. So I think that when you start thinking about, like, so how do you then interact at the individual level, and what are those factors? How do you identify individuals? Like, universities actually have a great opportunity, and I'm sure a lot of schools are doing this, but it's what they do with the information. The growing trend nationally is that a lot more kids are coming into school already on psychotropic medication, already having received treatment for some type of mental illness or mental health problem. Like when I was at MIT, like our department was made up of psychiatrists who were mostly therapists. And they were even nervous to prescribe Prozac. By the time I left, everybody was on medication coming through the door. And that's before, the first appointment, they're already, I'm on this, I'm on this, I'm on Adderall, I'm on this, and so on. So first, so identifying the kids who already need help and identifying the kids who are at risk. But like just like we do, at the hospital, where we screen people for problems. Like our hospital just decided, in really a huge, huge step, that every person coming through the hospital will be screened for substance abuse. Like, they just, it's not that difficult. It's not rocket science. And can we not screen for depression with 2 questions? Just takes 2 questions. Every person, so, freshmen have to fill out this information and stuff, their parents have to fill out stuff. It's a screening process, and then there is a potential there, and then instituting other steps along the way, because they may look good in August before they come, but by October, they're looking very different. And so, utilizing whatever freshman programs are available, but also we're going to screen people to try to identify. Now you pointed out that peers may be good and bad, and I agree completely. But what I found was that the peers were better at identifying the kids at risk than faculty, staff, mental health staff, and so on. Peers were like, there's a tolerance of, on campuses usually, of craziness, in a sense. But the peers know when they've gone too far. That guy's gone too far. Like, we do crazy stuff. We lie on the road at nighttime, but we never do that. Peers can identify kids who are gone overboard, who are off the chart and stuff. And through their social networking, they got it all on their phone. And so one of the things that I've always thought about, like we're piloting in developing countries, with low resources and so on, is utilizing cell phone technology with peer networks response teams. So you've got a cluster of people, and if somebody sees Johnny and they think, oh, Johnny's not doing well, sends out a text message to the team, and somebody says, oh, I'm in the dorm next to him. I'm going to pop over and see how Johnny's doing. Like peer response, like you're taking what you did, you're doing, and then let's say you identified somebody's having some difficulty. We're going to pop in, and then we have access to that mental health professional as a supervisor or something like that. We're doing this in developing countries. Shouldn't be done here. I mean, it's easy to do here. As I said, I think peers are the best at identifying individuals at risk. Let me just make a couple more comments so we have chance. Yeah. Now, the final thing I'm going to say, which kind of looks at the system issue, is that, truthfully, the institutions have to invest in diversity. They got to get serious about it. Like, if you're bringing these bright young people in, and you truly value them, then you have to value diversity throughout the institutes, throughout the university. We're at Harvard, And, and we have these discussions, and I'm thinking, they're trying to get there, but they're not there yet. Like I'm a faculty member, at the associate professor level throughout Harvard Medical School. They were holding some big event, and they invited all the associate professors of color. First they did the women, and then they did the men. And so I show up, and I'm thinking, God, this room's going to be packed. There were 10 of us. Now, Harvard has 10,000 faculty, right? All the hospitals and stuff. It's about 10,000 faculty. There were 10 of us at the associate professor level. That says to me that's not an investment in diversity. I mean, seriously. So, in other words, when you start to, build support for the students at all levels, it has to be throughout the university, including not just mental health providers, but faculty. They have to be exposed to faculty who can mentor them, who can take and provide some of that perhaps their parents were providing. They can develop that type of relationship. So there's somebody that they're not doing well, they can go to and talk to and so on. And because remember, the university is replacing their parents, right? Right? We took the parents out. So what is it that the parents do or give the individual that allows them to do well? The university has to replace that. Otherwise, you're going to have, and we do, have a lot of individuals running around not doing good things and not feeling great. And so it's that investment. If you're going to get serious, you got to get serious. So that's my last comment.
Okay, excellent. Thank you.